A military veteran hopes to pull off an upset in western Wisconsin. Tony Kurtz, who runs an organic farm, is the Republican challenging Democratic incumbent Ron Kind of La Crosse in the 3rd Congressional District. Kurtz deployed in both Iraq wars during a 20-year career in the Army. We asked Kurtz to go to our Eau Claire affiliate, WQOW-TV, to talk about the issues he feels are the most pressing this election year. Let's begin by talking about what you hope to accomplish if you're elected to Congress. You said, like many Americans, you're frustrated with gridlock, but what can one of 435 realistically do about it?
Well, first of all, thanks for having me on the show, Mike, but we've got to change the tone in Washington. It's a toxic environment, it really is, and I think that's one thing I hear from voters is they want both parties to work together to get things done, and what you find is both parties have done this. Republicans and Democrats have made this mess, and it's going to take Republicans and Democrats working together to solve the problems that we have in this country, and most importantly, what we have in this district.
Can you give me an example of a couple of issues, perhaps, where you could see yourself working with Democrats to accomplish a common goal?
Well, let's take the Affordable Care Act, Obamacare. My opponent in 2010 promised the men and women of this district that they were going to keep their coverage, that it was going to save money, and that they could keep their doctor. That's simply not true. And 4 years later, we're talking to so many voters in my district that they're losing coverage, they're losing that doctor, and it is not affordable. And I want to work with both parties to come up with some good, common sense solutions to fix this law. You know, I would like to see it repealed. If that's not possible, I'm definitely open to fixing this so it does help the men and women of this district. My opponent, once again, he thinks it's working. He thinks it's serving this district. And one thing I'd like to mention, Mike, in our district, 93% of the people before Obamacare had coverage. Wisconsin Hospital Association, for the last 6 years, we are top 5 in the nation for health care. So this district did not need Obamacare. Did we need to work on price control? Absolutely. And that's something, as the next representative of the 3rd District, that I want to solve with everybody, with Republicans, Democrats. I want to sit around a table. I want to get some solutions to help the affordability, the true affordability for health care for the men and women in our district.
Congressman Kind said on this program a few weeks ago, when I asked him about the Affordable Care Act, he said, well, what he would ask his opponent is, what would you replace it with? Are there certain facets that seem to be popular with the public? What do you replace them with?
Well, one thing, and let's get back, I'm a competition person. Competition drives down prices. Consumers choose. And remember, the patient is the consumer. They have the last word on what they want to do and the treatment options and how much the affordability is. Right now, this is not affordable. I've talked to so many men and women. I just talked to a couple the other day, Jessica and JD. They had Badger Care Plus. They liked Badger Care Plus before Obamacare. They could afford it. It was $179 a month. As Jessica told me, she was content with Badger Care Plus. Well, under Obamacare, she lost Badger Care Plus. Her premiums under Obamacare, under a bronze plan, more than doubled, and her deductible went to $11,000 for her and her husband, J.D. Well, needless to say, they don't qualify for subsidies. The health care is not affordable to them. So they're signed up on healthcare.gov, but they don't have health care. I'd like to see a competition where you can go across state lines. The part of the law that I've heard very popular is pre-existing conditions, and that's something I want to work with Republicans, Democrats to find a solution to cover people with pre-existing conditions, because I think we can all agree we want to cover those men and women that have pre-existing conditions, and that's part of the law that I find universal, that people like. In addition, I've talked to a lot of health care providers. They like the quality metrics that they're being graded on. They think that's a good step in the right direction. So there's parts of the law that I think we can salvage, but the vast majority, you know, a lot of that needs to be reworked and redone.
Kurtz, the Republican, has also been critical of U.S. foreign policy, telling me that President Obama and Congressman Kind shouldn't be telegraphing our intentions to our enemies before taking action. And I'll be right back with a look ahead to the important interviews coming up on next week's program. And for political news throughout the week, be sure to follow me at Mike Boucher on Twitter.